Has your baby been defined as having colic? I'm Dr. Prince, your pediatrician BFF, and I want to help you understand what that word really means and why it often raises more questions than giving answers. So the American Academy of Pediatrics defines colic with the rules of 3. And that means crying for more than 3 hours a day, at least 3 days a week, and for more than 3 weeks, in an otherwise healthy, well-fed baby. Now, here's the tricky part. Nobody actually knows what causes colic. Some people believe that it's related to baby's immature nervous system that's adjusting to life outside of the womb. And then others will say that colic is simply a 5-letter word for the doctor doesn't know why. And in fact, a lot of what gets labeled as colic is actually something else. It might be reflux, food sensitivities, or maybe other medical issues. And that is why colic should always be considered a diagnosis of exclusion. Serious causes need to be ruled out before a baby is labeled as colic. So what does that mean for you as a parent? A good provider should take a full history. They should ask about your baby's crying patterns. They should check in on feeding and spitting up history. And they should also rule out things like reflux, pyloric stenosis, or even heart and lung concerns. And then if all of that has been checked out and the diagnosis is still colic, it should feel reassuring, not dismissive. And if you don't feel heard, please seek a second opinion. You know your baby best, and you are their voice.